My name is Nixon Jean. I'm a nurse practitioner and I'm specialized in psychiatry. It's been a year since I've been working for CFH, but for me it looks like so many years. Before joining CFH, I was working as a nurse. I have 11 years of experiences, and I've worked with in the nursing home, with the geriatric population. I've worked with the OPW DD population, which is individuals with developmental disabilities, and all those years, have prepared me to bring my skills to another level. After I passed my board last year, and I was looking for a job. I was reading certain companies. So at first I just posted my resume there, but when I receive information about care for the homeless, so I research it and I say, okay, this is a good area to start with, especially I'm used to work with underserved population. I will feel more at ease between the patients and provider. It's very important to create that trusting environment, not only based on the stigma they were raised they are raised around, but also as human being, we do not trust other humans naturally. It takes time to build that. And so whenever I receive whatever patient, whatever the ethnicity of the patients, the cultural or the social background, so I make sure that I create this trusting environment so that they can open up to me, because without them, I'm not God. I cannot read their mind, so they have to expose me, to tell me what's going on in their life, and in that way I'm in a better position to provide them with the care. Also, I bring my patients into a therapeutic relationship with me by focusing on their needs, their particular needs. I use qualities such as genuineness, acceptance, being non-judgmental to them, being empathetic to them, and most importantly show them respect. CFH, the members, high management, they deserve high commendation for the work they are doing, especially in New York. It's a city that welcome immigrants, and many of them they have left their countries for different reasons. CFH is able to provide them with what they need at the right moment for immigrants, or even for some locals. I've met certain individuals in my line of work. They were having a nice life, a good family life, and then all of a sudden and even a tragedy come into their life, and then they became homeless. It is not something that they were looking for, but unforeseen events happen to everyone, and then CFH was right there for them. And some of them, they expressed to me their appreciation for what CFH has done for them or continue to do for them. And then also the prison population. So these individuals, they were in there, they were inmates, and then now that they come out, nobody wants to hire them. And then so they deserve a second chance or another chance to begin their lives. And then so when they come to meet a psych doctor, a psych provider, so we can kind of orient them, help them to see what are their strengths, and then what are their weaknesses, and then how they can use their strengths, use the resources available in the community, to start over, to see the future in the bright light. And then that's exactly what CFH is doing. So that's why I wanted to commend them, so that they can continue to do the same work. And on my side, I will do my best to continue to make myself available to the patients and to CFH.